Welcome back to the show. The COVID-19 pandemic has affected many individuals across the globe, particularly right here in New York City and even more close to home, the borough of the Bronx. The Bronx remains one of the areas hardest hit by COVID-19, but still has one of the lowest rates of vaccination inoculation across the city. A recent survey found that 8% of Bronx residents have decided against getting the vaccine. Meanwhile, 49% indicated concern about side effects as a significant factor in their decision. Bronx Public Charter Schools has hosted a bilingual virtual forum for school staff, students, parents, and families that are aimed at dispelling some of the myths attributed to the COVID-19 vaccine. Here now to share more is the CEO of Public Prep, Janelle Bradshaw, and pediatrics intensivist at Children's Hospital at Montefiore, Dr. Denise Nunez. And we welcome you both here to the show.
Thank you so much for having us.
Thank you.
Thank you. And I guess I'll go first off with you, Janelle. Share with us a little bit about this vaccination hesitancy. We know that it's huge in communities of color. What has been your experience?
Yeah, so again, thank you so much for having us. As someone who was born and raised in the Bronx, this is something that's really near and dear to my heart. And what we're hearing from our families and our staff very early on was concerns about whether or not the vaccine was rushed through, this label of the idea that it's somehow experimental, that people were concerned about just the history of vaccines in our communities. And later on, what we've heard is just access, the ability to sign up for an appointment and have the wherewithal to have 6 different logins, to be on at 2 and 3 o'clock in the morning, to understand who's eligible. I'm really excited that as of tomorrow, 16 and up are eligible, because explaining who was eligible was also creating a level of hesitancy. And so now through our town halls and partnerships with Somos, we've been able to really dispel these myths and really help our families and our staff get the information that's needed so that they can do what we are all doing, which is do our part to get vaccinated. And so those are the things that we're hearing on the ground here in the Bronx.
Dr. Nunez, a little bit about what you're hearing, because obviously as a doctor, a lot of questions, a lot of skepticism. What are some of the common things that you're hearing, and how can we debunk some of these myths?
Oh yeah, so not hearing, but also living it. Because as a pediatric intensivist and also working in the urgent care and as a provider in the community, there's a lot of misinformation, and a lot of people don't think it's safe. A lot of people think that there's a lot of side effects, and exactly that there's no scientific base behind the vaccines. And it was amazing being able to speak to these parents and not only explain to them about how the vaccine was created, all the data behind this, the production of these vaccines, but also explaining it in lay terms. Sometimes you want to explain things to parents or to the community in medical terms, and people don't understand it. So it was really nice to explain and then actually hear back the questions again and then understand where they were confused. And really it's they were thinking more of this vaccine was created for a purpose, or are they injecting the virus? People are very afraid of what happened to us, to the Latino community, and all of us here in the Bronx. And they were thinking that they were getting the vaccine injected, so the coronavirus injected. So clarifying all those myths was very important for us and for me. So those are the main things I've been hearing, and very afraid of side effects, very afraid of everything that's said in the social media. People have a lot of social media access to it, and they can just hear all this misinformation and they believe it, sadly. So having this time one-on-one with them and explaining all their doubts and questions was amazing. So I'm very happy we're able to do this.
For parents and this opportunity, families to actually have an opportunity to discuss this, talk to us about the concept and how parents now have this opportunity, and families also as well.
Absolutely. So we, just in my own personal networks, have had opportunities to be a part of amazing town halls that had medical experts. I'm a member, proud member of Delta Sigma Theta sorority, and have participated in many webinars in my own local community that helped me make decisions. And I wanted to make sure that our families had the same level of access, because when you are hearing directly from medical experts, and being able to ask your questions. I remember one webinar that I went to that was shared through blackdoctors.org that featured Dr. Fauci on Facebook Live many, many months ago. It really helped me understand that when it was my turn, I would have to do my part and get vaccinated. And so when educators became eligible on January 11th, I was first in line. And again, I experienced everything our families are going through, trying to sign up and find a vaccination, and ending up outside of my neighborhood to get vaccinated because it was that important. We created in our own network opportunities to share our stories, because we knew the importance of being trusted members of the community to say, I've been vaccinated, when it's your turn to do your part, and really understanding what the barriers were for staff and families. And again, as we sort of went through the different waves and months, as more and more people became eligible, what we saw was actually less about hesitancy and myths and more about access and how do you actually sign up for a vaccine. And I think the work that is happening in our communities around mobile vaccines, really thinking about the ability to sign up for an appointment through calling, because many of our families do not have access to Wi-Fi, certainly stable internet connection. We started pairing staff members up with each other. So there were, we call them Sherpas internally, someone who would help you get a vaccine, and then eventually created a partnership with the local NAACP so that our staff and families have access to a dedicated vaccine scheduler, someone who's certified in New York City, and through a phone call can help you sign up for a vaccine. It's that important for us, and we're working on, creating a site at one of our schools where our families can get vaccinated, because we know when we partnered with the Mexican Coalition for Families, for example, for testing, that brought more families out of the shadows. And so, again, we like to think that we are all doing our part by A, knowing our status, and B, getting vaccinated when you're eligible. The question that we get now from families is, when will their children be vaccinated? And so again, we have seen a level of focus shift, but what we are pushing right now is we want adults in families, multi-generational homes, to be vaccinated. Again, now that they're eligible, 30 and up as of last week, 16 and up tomorrow, to be vaccinated right now. And we'll cross the bridge on children when that becomes available. But certainly for us, those are just some of the examples that we saw of how I wanted to use my own personal knowledge and resources to expand it, and give back to my community, who I think, if given the information, will rise to the occasion and get vaccinated.
Dr. Nunez, before we wrap things up, I want to have an opportunity to talk to you for a second about these pop-up sites, right? And taking it to the streets, if you will, and the effectiveness of it. For someone who doesn't understand the effectiveness of taking these vaccinations to the streets, please explain from a medical perspective what it means to you.
Well, it's going to the community. So we are doctors from the community, and it's going towards where our patients are. So that has been very important, and we've been able to vaccinate a lot of patients this way. And more importantly, now all of us in the community, doctors, are able to get the vaccines now, and actually in our own practices, we'll be able to give the vaccines to our patients, which is very, very important, because our patients trust us, trust a community provider. And we have time to sit down with them and explain to them, just in case they have any questions. So it is very important that patients come to their providers. We look like them, we speak their languages. So we're very happy that soon we will have our vaccines in the community, the same we have in all these pop-ups locations, that thanks to Somos Community Care, we were able to do this with all the 2,500 providers we have, the community providers. So now we're going to have them in our practices, and our patients are going to be able to come to us. because the access of getting the appointments has been terrible, and the websites and it's just people don't know how to use them. So sure, definitely the phone calls have been great. Partnering, having community health workers like we have also to help them make the appointments, but now they're going to be able to come to us directly, which is amazing. So this has been a great experience, and I know that with the providers having their vaccines in their practices, we'll be able to reach many more people now.
Well, I want to thank you both for the work that you guys are doing for both access and then also awareness. Dr. Nunez, I know you've been working some
Thank
long
you.
hours. Thank you for being with us here on Open. Janelle, thanks again. And of course, we'll get our viewers up to speed as to how to be connected to you. Thank you both.
Thank you so
Thank you.
much.
All righty. Well, I want to let you know if you want more information, visit their website at publicprep.org. And then you can also follow them on Facebook and also Twitter at Public Prep. We encourage you, please don't go anywhere. We do have more show. Stay with us. We'll be right back in a few.